Hello everyone, I'm Dr. Aditya Sai. Welcome to our channel Shoulder and Knee Clinic, where we discuss various issues pertaining to shoulder injuries, knee injuries, sports injuries, and so on and so on. So, if you like our channel, do share, subscribe, and like our content. So, today we are going to discuss something very important: why people are unhappy after rotator cuff surgeries. So, as such, rotator cuff repair surgeries have very good results and very good long-term outcomes. However, you might have come across some individual who is not happy with the rotator cuff surgery. So, let's delve deep into that. So, one of the most important reasons certain people are not very happy is they have not been counseled adequately with regards to how they expect their recovery and improvement in function. There are different types of rotator cuff tears. There are small tears, large, massive tears which involve multiple tendons, tears where there is significant muscle atrophy. So depending on that, your recovery and recovery of strength varies. If the pre-operative counseling is not adequate with regards to when an individual should recover fully, when the pain relief should be there, how soon they should expect a movement in their shoulder, generally that leads to disappointment. So that is one of the things. So typically for a regular large rotator cuff tear with no muscle atrophy, you should have good movement in the shoulder by around 2 to 3 months, and you should expect to gain the full movement by around 4 months, and typically full strength by around 6 months. If there are always exceptions with regards to individuals who can achieve faster results, at the same time there is another spectrum where individuals can take slightly longer time to improve. When there are rotator cuff tears which are small or partial tears, so these individuals tend to have more prolonged recovery with regards to pain relief and improvement of stiffness. So that's very important to understand that compared to a large rotator cuff tear, a smaller tear generally tends to have more pre-operative stiffness. Their strength recovers faster, but the recovery of movement as well as stiffness is slightly lower compared to a regular 2 centimeter rotator cuff tear. Now, the other aspect which also needs to be considered is the case of large tears or massive rotator cuff tears. So, when there are more than 2 tendons involved, generally the movement still recovers faster, but recovery of strength is slower and it can take up till 7 to 8 months. When we look at tears where there is some amount of fatty infiltration, this recovery can take up till 9 months to a year also. So essentially it depends on the stage at which you undergo the procedure. So it's always advisable that once a rotator cuff tear has been diagnosed, that you have a full thickness rotator cuff tear, it's always advisable that you undergo the procedure early rather than waiting on it. What happens is, a lot of times individuals undergo rehabilitation for a full thickness rotator cuff tear, and obviously the shoulder movement improves, the pain level improves, strength doesn't return, but a lot of people don't notice it. So there is a misconception. People tend to feel that they have recovered completely, which is not the case. So it's very dangerous to ignore a full thickness rotator cuff tears. Typically, women take longer to recover post rotator cuff surgery compared to men. Now, suppose there has been a full thickness rotator cuff tear, a massive tear which there is a significant fatty infiltration. In those scenarios, if you just perform a repair, then individuals are not very happy because there is no muscle left actually to improve the shoulder function. In these scenarios, other procedures like tendon transfers or capsular reconstructions are better suited. There are obviously cases of rotator cuff tear repair failures, especially when we are repairing massive rotator cuff tears in women above the age of 65, people who have osteoporotic bone. In those scenarios, the risk of failure of a rotator cuff repair is higher. There are always scenarios where there is overtensioning of the rotator cuff which can lead to surgical failures. So these are few of the reasons why sometimes rotator cuff surgery doesn't work out. So it's very important that once the problem is diagnosed, you get it treated early, get it treated with a proper shoulder surgeon so that he can make the right decision for you. So thanks for watching. If you like our content, do share and like, subscribe to our channel.